When fitting a full face mask, a measuring guide is often included in the packaging. In general, a full face mask should sit between the indent at the nasal bridge and the indent below the lower lip. The measuring guide should line up with these two landmarks. In this case, we'll be fitting a medium full face mask, and the majority of patients will be a medium size. When applying the full face mask to the patient, first, position the straps on the top of the head. Next, line up the top of the mask cushion with the nasal bridge and the bottom of the mask cushion with the indent below the lower lip. And ensure the fit is symmetrical and firm. Make sure pressure on either side of the mask is similar. Also, secure the mask firmly to minimise mask leaks. Next, attach the tubing to the bottom of the mask and switch the device on. If the patient has some difficulty tolerating the mask, the straps can be unclipped and the patient can practice holding the mask on their face and taking it off as they wish in order to acclimatise to the treatment. And once they are comfortable, the mask can then be re-secured with the lower straps. When fitting a nasal mask like this one, a measuring guide may also be included in the packaging. However, in general, the nasal mask should sit snugly around the nose without touching it and without overhanging the lip. When applying the nasal mask to the patient, first slide the straps over the top of the head and pull the mask forward over the nose. You can ask the patient to hold the front of the mask while you clip the straps at the bottom, like so. With a nasal mask, firm pressure is not always required as long as the pressure on each side is similar. Next, apply the tube to the bottom of the mask and switch the device on. Instruct the patient to breathe in and out through their nose and try not to open their mouth. It might be useful to distract the patient by giving them something to read or watch. If the patient's having difficulty breathing in and out through their nose, it might be useful to unclip the bottom of the mask and have the patient lift the mask on and off their nose as they're comfortable, slowly getting used to breathing in and out through their nose. However, if the patient has some nasal obstruction or nasal blockage, a full face mask may be warranted. When using a nasal mask, sometimes it's also necessary to apply a chin strap to support the lower jaw when the patient is asleep.